everyone, my name is May Masangit and I am from BSN2A. This time I will be performing a return demonstration on how we are going to administer a vaccine through the use of intradermal injection. But before anything else, let's define first and determine what is intradermal injection. So this type of injection is administered through the dermis. It is also used to administer protein immunization, especially BCG. We also have determined that this kind of injection is used for several sensitivity tests. For example, we have the TB, allergy, and anesthesia. The most common site for this kind of injection is the inner surface of the forearm. This must be given off the right deltoid. In choosing the site of injection, make sure that it is free from any kind of lesions, rashes, and of course molds, because this could eventually alter the visual representation of the test result of the vaccine. The type of vaccine that is being administered through intradermal injection is the BCG, or the Bacille Calmette Guerin. So this is a type of vaccine in which it protects infants from TB or tuberculosis. This could be done through the right deltoid of the infant, and it should be injected 90 degrees angle, and the dosage must be given through 0.05 ml. Furthermore, always remember that when we are injecting or administering a BCG, there is a appearance of small raised bump in the injection site. So this bump will remain until 4 weeks, and then when the child will grow up, the appearance of this bump will still present. So this is to determine easily, especially for the infants that they are already vaccinated with BCG. Always remember that a BCG is a type of vaccine which must be mixed with a diluent. So this is a powder type of vaccine that must be mixed together with a diluent in order to easily administer towards the infant. May buntag, ma'am. Ako da inyuhang student nurse karon. Akong pangalan kay si May Masangit. Nag-eskwela ko sa Davao Oriental State University, ma'am. So karon, ma'am, maghatag ko, mag-administer ko sa imuhang baby og BCG. Kani siya nga vaccine, ang tawag ani kay Bacille Calmette Guerin, ma'am. Kani siya ang pinaka-importante nga vaccine na kailangan ituro or itusok sa imuhang baby sa iyahang right deltoid diri ang dapit nga muscle, ma'am. Kay para ma-prevent ang any diseases or contagious na mga diseases, ma'am. Okay lang ba, ma'am?
Okay lang, ma'am.
Always remember that establishing a rapport towards your patient will allow them to be more comfortable, especially when you are going to administer the patient to. This would be done by smiling or providing a good connection towards your patient. After introducing yourself and answering questions and clarifications, make sure that you already prepared the vaccine that you need, and also to ensure that it is properly identified to reduce the risk of administering the wrong one. You could also use a label to be put in the vaccine in order for you not to be confused when you are already giving or administering the vaccine to the infant. And in order to avoid a risk of infection and cross-contamination, make sure to perform hand hygiene and prepare a clean table in where you're going to make or to perform the procedure. And of course, make sure that you are preparing already the syringe that you will be using, which is the tuberculin syringe for the intradermal injection. After gathering the materials or the supplies that you need, make sure that you already provide a privacy towards the patient. This could include by closing the door and moving the bedside curtains, because this could help the patient to become more comfortable, and of course there will be no distractions while administering the vaccine. Ma'am, pwede ba na ako makakita na imong booklet, ma'am? So, mo ang first dose sa imong baby, ma'am, no? Ako ang i-administer sa'yo, ma'am, kay BCG, ma'am, ha? Para, ma'am, position na pa imong baby, ha? Para di ka mag-insult pag mag-insect na ta. After positioning the infant into a caudal position, make sure to identify the site in where you are going to inject the vaccine. Make sure to choose the site in where it is free from any kind of lesions, rashes, and of course from moles. After assessing your client, make sure to perform hand hygiene and of course to wear sterile gloves in order to avoid any risk of infections and contaminations. But before anything else, make sure to remove any kind of jewelries in order for us to eradicate or to reduce any kind of infections, and this could actually allows the microorganisms to reproduce easily. Selecting a site in where you are going to administer the vaccine, make sure to identify that it is free from any lesions or scars, and make sure that you already clean the site of where you're going to inject in order to eliminate any kinds of pathogens in the skin of the infant, and of course to avoid or reduces the risk of infection.
Make sure to clean the site of injection with warm water and not alcohol. Make sure to clean the vial first before getting an amount of vaccine in order not to contaminate the needle. And after that, make sure to remove the needle from the cup by pulling it off in a straight motion. And gently get a small amount of vaccine from the vial. And then check the syringe if there is air inside it, and make sure to remove it by pushing the plunger. Hold the syringe with your thumb and finger. Make sure to lay the needle almost flat along the skin into 10 to 15 degree angle. And gently insert the needle into the dermis of the skin, and then press the plunger slowly into the dermis with a thumb. Once the syringe is in place, slowly inject the solution or watching for a small wheal or bleb to appear. And withdraw the needle with the same angle. After removing the needle, make sure to engage a safety shield or needle guard and discard it in a sharp container. Make sure that do not massage the area and put a cotton on it. Needle disposal will prevent stick injury. Make sure to discard remaining supplies in order to prevent the spread of microorganisms, and also remove your gloves and perform hand hygiene or use an ABHR. And for the last steps, make sure to document procedure and findings in order to help ensure the patient's safety. Document the time, location, and what type of vaccine is being injected.
all for administering a BCG vaccine using the intradermal injection. Thank you for watching and have a good day.